In a patient on ECMO, fluid creep, unintentional fluid accumulation from multiple drips, is most effectively managed by which hemofiltration indication? A. Intermittent hemodialysis. B. Continuous venovenous ultrafiltration, CVVU. C. Peritoneal dialysis. D. Bolus diuretic therapy. Answer: B. Continuous venovenous ultrafiltration, CVVU. Explanation: Continuous ultrafiltration is indicated for fluid creep because it allows for minute-to-minute adjustment of fluid removal to match the intake of essential medications and nutrition, preventing the peaks and troughs of fluid status seen with intermittent therapies. Which specific patient population on ECMO has a lower threshold for starting hemofiltration to manage hyperphosphatemia? A. Patients with acute pancreatitis. B. Pediatric patients with multi-organ dysfunction syndrome, MODS. C. Patients with chronic obstructive pulmonary disease, COPD. D. Patients with isolated respiratory failure. Answer: B. Pediatric patients with multi-organ dysfunction syndrome, MODS. Explanation: Pediatric patients are particularly sensitive to electrolyte shifts. In the context of MODS on ECMO, hyperphosphatemia is a common indication for CRRT to prevent secondary hypocalcemia and cardiac arrhythmias. What is an indication for using regional citrate anticoagulation, RCA, for the hemofiltration circuit while a patient is on systemic heparin for ECMO? A. To increase the patient's systemic pH. B. Frequent clotting of the CRRT filter despite systemic heparinization. C. To reduce the patient's ionized calcium level. D. To increase the life of the ECMO oxygenator. Answer: B. Frequent clotting of the CRRT filter despite systemic heparinization. Explanation: If the CRRT filter clots repeatedly despite the patient being on heparin for ECMO, adding regional citrate to the CRRT loop is indicated to extend filter life without increasing the systemic bleeding risk. In VA-ECMO patients with cardiogenic shock, hemofiltration is indicated to reduce right ventricular, RV, overload by targeting which of the following? A. Decreasing the mean arterial pressure, MAP. B. Reducing central venous pressure, CVP, and venous congestion. C. Increasing the heart rate. D. Increasing the hematocrit to 45%. Answer: B. Reducing central venous pressure, CVP, and venous congestion. Explanation: Reducing CVP through ultrafiltration decreases RV preload and improves the pressure gradient for organ perfusion, which is a vital indication for CRRT in heart failure patients on ECMO. A patient on ECMO for rhabdomyolysis is producing tea-colored urine. What is the indication for hemofiltration in this specific context? A. Removal of myoglobin to prevent Pigement-induced nephropathy. B. Increasing the serum potassium level. C. To provide extra oxygenation to the kidneys. D. To lower the blood pressure. Answer: A. Removal of myoglobin to prevent Pigement-induced nephropathy. Explanation: Myoglobin is a medium-sized molecule, 17,000 Daltons. While standard dialysis is less effective, continuous hemofiltration, convection, is indicated to help clear myoglobin and protect the remaining renal function. Why is hyperlactatemia, lactate greater than 4 millimoles per liter, an indication for starting CRRT in a patient on VA-ECMO, even if urine output is maintained? A. Lactate is a primary fuel for the heart. B. To clear lactate when the liver is unable to metabolize it, type B lactic acidosis. C. To decrease the oxygen demand of the brain. D. To increase the CO2 removal through the sweet gas. Answer: B. To clear lactate when the liver is unable to metabolize it, type B lactic acidosis. Explanation: In ECMO patients with hepatic congestion or failure, lactate clearance is impaired. CRRT is indicated as a bridge to manage the associated metabolic acidosis while waiting for circulatory improvement. Which of the following is a technical indication to stop or pause hemofiltration that is integrated into an ECMO circuit? A. When the patient begins to shiver. B. Significant chattering or suck down in the ECMO venous line. C. When the patient's temperature reaches 37 degrees Celsius. D. When the blood sugar is 150 mg per deciliter. Answer: B. Significant chattering or suck down in the ECMO venous line. Explanation: if the CRRT pump is pulling blood too aggressively from the venous side of the ECMO circuit, it can exacerbate negative venous pressures, leading to chattering. This is an indication to adjust flows or pause the CRRT. In patients with severe burn injury on ECMO, what is the primary indication for high-volume hemofiltration? A. To replace skin lost to the burn. B. To manage the massive fluid resuscitation requirements and inflammatory surge. C. To increase the patient's core temperature. D. To deliver intravenous antibiotics more quickly. Answer: B. To manage the massive fluid resuscitation requirements and inflammatory surge. Explanation: burn patients require massive fluid volumes. CRRT is indicated early to prevent resuscitation injury, excessive tissue edema, and to manage the overwhelming cytokine storm associated with major burns. What is the metabolic indication for CRRT in an ECMO patient who has developed hypernatremia, sodium greater than 155 milliequivalent/L, from concentrated infusions? A. To provide free water clearance. B. To perform controlled sodium removal using a customized dialysate/replacement fluid. C. To increase the osmolality of the blood. D. To prevent the patient from feeling thirsty. Answer: B. To perform controlled sodium removal using a customized dialysate/replacement fluid. Explanation: rapid correction of sodium can be dangerous. CRRT allows for the precise, slow correction of sodium levels by adjusting the sodium concentration in the replacement fluid, which is safer than bolus fluid administration in heart failure. Prophylactic initiation of CRRT on ECMO, starting before rifle/DIGO criteria are met, is often indicated in which scenario? A. When the patient is expected to be on ECMO for less than 24 hours. B. When there is a planned aggressive mobilization or transport of the patient. C. To manage severe, refractory hypothermia. D. In the presence of profound anasarca, total body edema, at the time of cannulation. Answer: D. In the presence of profound anasarca, total body edema, at the time of cannulation. Explanation: if a patient is already profoundly edematous at the start of ECMO, prophylactic CRRT is indicated to immediately begin unloading the tissues to improve the chances of organ recovery.